Yeah, sure, Nimisha.
Yeah. So how are you doing this morning, ma'am?
I'm fine, Nimisha. You tell me, where are you? No, where are you from?
Ma'am, I'm from Jamshedpur, Jharkhand, ma'am.
Okay, so all this is what online internship with Dorai-Foundation.
Yes, ma'am. Yes, ma'am. So basically, I am currently studying in ITM Business School, Khargar. So this is a part of
Okay,
our
oh,
15-day NGO internship program with Dorai.
okay, okay, okay,
Yes.
right.
So to begin with, ma'am, the first question would be, could you tell us a little bit about yourself and your child, please?
Okay, my name is Dr. Neelam Sodhi, and that tells you that I am a doctor. I'm a medical doctor. I'm a gynecologist. I've been practicing for, I think, around, and my son has cerebral palsy. Um, he is a software developer working with a MNC. He is based in Bangalore, but currently it's all work from home for everybody. So that's about me. Yeah.
That's amazing, ma'am. Software developer, and right now he's been staying with you, right? Because of the COVID and
Yeah, because
everything.
yeah, yeah. So since March, when the lockdown first happened, March what, 2020. So that was the time when he came back. And
Okay.
before that, he has been in Bangalore living on his own for more than 2 years. More than 2
Okay, ma'am.
years
So,
living there.
ma'am, basically, this internship is to spread awareness about and spread a message to parents who have special children. So, if we speak about the society on a different level, so do you feel that the society somewhere treats people who are specially abled very differently?
Of course, uh, whether you use the word specially abled, you use special needs, or you use the upfront disabled, it's all the same. It's just what appeals to anybody's mindsets or way of thinking that you use those terms. It doesn't away from the fact that this is a group of people, a section of society which is still does not receive does not have inclusivity in everything, and is of course seen still as different. And I don't think that this is something which is just in India. This is something which happens all across the world. So that is why the struggle, the fight, the ongoing um, advocacy for rights is something which is worldwide. So whatever we may have done, if I would say that now 25 years from now when we started our journey, and is it better? Yes, definitely it is better, because a lot of people like me would have, especially parents, and even of course so many professionals would have uh, worked in society at different levels to create a change. Well, yes, we have made difference, but to say that we are even 50% uh, there in getting society to automatically look at somebody who behaves differently, or who uh, as the same as everyone else, that's not been achieved. Yes.
That's so true, ma'am. That's definitely very true. And, ma'am, do you think the role of any teacher or mentor in their life is very important? Like, what is the importance of the role of a teacher or a mentor? The teacher could be anybody, even you could be his or her teacher. So, what is the importance of that role in their life?
Let me put it this way, Nimisha Anand. You are studying business, right? You're at a business school, right?
Yes, ma'am.
What is the importance of a teacher with you? What for you? What is the importance of a teacher for me? My postgraduate teacher is still someone I'm connected with, and if it were possible, I would still be connected with somebody who has been who was my teacher in nursery school. I remember those. And it is because of them that I am what I am. Okay. And that is the role of the teacher. And one more thing that I would like to say here, again, Nimisha, that when we talk about people with disabilities, situations in life are pretty much the very same for them as they are for anybody else. And in terms of social role valorization, which is a concept, maybe you want to just write down those words, social role valorization, and go look up what it means. There is a term which is used, a phrase which is called culturally valued analog. Culturally valued analog is
Culturally,
in any society, what is the uh, in that culture, say in Chennai, uh, a teacher might be worshipped in a different way, or a food, some food item might be made in a different way because that is the culturally valued analog there. Okay, but uh, it is not different. It may differ from culture to culture, but the practices that exist for anybody in society, disabled or non-disabled, have to be the same. So the role of the teacher is going to be role of the teacher or a mentor is going to be pretty much the same for any person with disability. Sorry to have expanded this answer because I wanted you to get that word culturally valued analog. Because whatever questions or whatever thought process that goes on in your mind in the future, if you do not if you do not want to differentiate, if you do not want to separate uh, people with disabilities from the non-disabled, then remember that what is the culturally valued analog will always work best for just about everyone. If I say that I want to do special education, let me also tell you that the methods of special education, what does special education entail? It is teaching in the concrete, teaching anything with the concrete, and then you go to a pictorial thing, and then you go to abstract. So even if Nimisha were to be taught counting, your mom would have taught you, or somebody in school would have taught you with pencils. Nimisha, this is two, one and two. You could call it special education because it might just take more time and probably we go that way. But Montessori method and special are not different. They are pretty much the same. So I do not know what exactly you are aiming to ask. Maybe this is a very long-winded answer. But what I just want to say that finding that correct person, the person who's passionate and dedicated, the person who takes an interest in your well-being, the person who motivates and inspires is a teacher and a mentor, isn't it? And you, if your student cannot learn, what does the teacher say? You are a duffer, or does she a good teacher? Do they turn around and ask themselves that I was not able to teach my student properly? What would 8 minutes? Just a minute, Nisha. Yeah, sorry. Go on.
Ma'am, moving forward to our next question is, do you feel that there's an actual need for special schools? Like, why can't they join the same school and be in the same school? Do you feel that there's an actual need for a special school to be there?
Well, I'm a person who believes in inclusion, but yes, there are since there are many aspects to inclusion, and since school is a place which is education, it is a place where there are so many other children who get together and maybe play together. There are so many languages being spoken. There is so much of vocabulary build up. There is so much of learning and interaction. There is so much of socialization skills uh, which every child learns when they are in a mixed sort of a setup. So, a school, a mainstream school or inclusion is something which I really advocate for. But having said, if the school situation, the atmosphere is more vitiating than supporting, and if cannot be included for whatever reasons or integrated also into a mainstream school setup, then yes, special schools also have a place. In a country like India, we can never say that there is no space for special schools. Yes.
Definitely. Ma'am, so now we would like to know a little bit more about you. So tell us one fond memory of you and your child. So like one fond memory or something that you learn from your child. So one memory or one thing that you learn from your child.
God, Nimisha, I woke up, did my exercise. There is a patient waiting, and you asked me to become creative and give you one fond memory. Uh, my
Ma'am,
son,
any memory would do.
yeah, doctor, and then I used to practice in my clinic. And because this toddler of mine, he is intelligent, so intelligent, but at that time, play and everything, not things that we needed to teach him. He was doing it all himself. So he would walk into the clinic, and then I would be writing a prescription. He would pick up those words that I would say. And since it is my habit to explain drug names to patients, and I would say, okay, I'm writing so and this is for your pain and all. So and his father's an orthopedic surgeon. So he picked up certain,
Okay.
brand names also. So what he would do, he
Okay.
would observe us, and then he would go inside and go to any of the family members, pick up any scrap of paper or anything that he could find and a pencil. And although he couldn't write legibly at that time, but he would say, "ये ब्रूफेन है, इसको दिन में 3 बार लेना है. ये दवाई आपको 3 बार लेनी है. ये दवाई आपको ऐसे लेनी है." So he was that perfect doctor. So uh, he was amazing.
That's
He is
lovely, ma'am.
amazing.
That's lovely, ma'am. That's lovely. Ma'am, so moving to our last question. That's one question we ask all our guests here. One message that you would want to give to our viewers, like one message about there are many parents who still are trying to know how to adapt to the situation. There are so many people out there who can't even deal with people in the society. So, like one small message that you would like to give to our viewers.
You know, Nimisha, you're talking to Neelam Sodhi. There can never be small messages. You already learned that by now. So, I am just going to say this. Life doesn't stop because you have a child who has challenges. And asking the question, why me, is not going to give us any answers. Denying something is not going to get you anywhere. So, the best thing is, God has handed you a gift. A child is a gift. And God felt that you were the best person to receive that gift. So that child is a gift. And like any other child, any other seed which grows out of um, which grows out, becomes a plant and needs nurturing. So this child also needs nurturing. Maybe this child needs more nurturing than other plants do. And the best way to do that nurturing is to learn how to nurture that plant. Uh, Common sense is a huge help. You get confused by what therapists, teachers, and society is telling you. They'll tell you your child is not capable, your child cannot do this, your child has these shortcomings. I would say open your eyes, open your ears, and open your heart and see what's so beautiful about your child. So when you open your what the world has to say, but you are seeing your child just as your child is, and you are the parent, you begin to realize those beautiful things that your child can do, can understand, can communicate with probably only you. That child might not be able to tell the world, but the child is telling you because you are the parent. And, you know, routinely I tell mothers, since I'm a gynecologist and I bring in babies into the world, so I would routinely tell mothers of new mothers who will say, I do not know how to feed my baby. And I said, you can never go wrong. There's an instinct. Parenting cannot be taught. Parenting is a hands-on job. Parenting is something you learn, and parenting is something you decide by common sense also. You cannot go wrong. So, leave. That is the biggest message that I would like to give is believe in your child. Shut your eyes to all that is not possible. There's nothing like not possible. And I think Jaswinder Singh Sodhi, my son's life, proves that problems can be surmounted. You just want to know how to do it. So everybody's life is different. Maybe uh, we were we had some opportunities which a lot of people are not going to have. Everybody's situation is different. Everybody's life is different. But given the circumstances that you have, believe in your child, use your common sense, get yourself up to whatever knowledge you can. Because when you have the knowledge, and if the teacher, the therapist, or somebody teaches you how to do something, you're going to multiply it times because you will have learned what works and why it is needed. So, belief, don't feel tired. Find lean on, find somebody to unwind, relax yourself, take care of your health, all parents out there. Because if you are good, you're going to be able to take care of your parents. So don't destroy yourself in the process. I know.
That's lovely, ma'am. Thank you so much, ma'am, for being here. Just 1 minute, we would just like to present you one certificate for your time. Please, ma'am. So let us do that.
Thank
So, ma'am,
you.
this is a
Thank you
certificate.
so
Thank you
much
so
for
much
that.
for being
Thank
here.
you, ma'am.
It was
Bye.
lovely, ma'am.
Sachi and Nimisha,
It was really lovely.
Nice
Yes, ma'am.
talking to
Thank
you,
you, ma'am.
and thank you for that recording Google Meets. I've learned something new.
Thank you,
Bye. Have a
ma'am.
nice day.
Thank you, ma'am. Thank
Thank
you.
you so much for your time, ma'am. Thank you.
Thank you, ma'am.